So, Jadene, it's been a while since we've caught up on what's happening in your world and your life with Matt and how things have been going. Fill us in a little bit.
Life is going. I think I've told you, ladies, that Matt's had some choking incidents in the last year. Enough that we were concerned that maybe we should do a swallow study to, we're lucky he's not gotten aspiration pneumonia. But that is a worry that I have because he was choking. It was lengthy. I was very pleased with the level of detail in it. But I came to one place where I pushed back. It was all, a little talking in my head like, that's not Matt. Because she had said Matt was not a candidate for therapies. And I took that to mean, like moving his tongue. We did that when he was little tiny and just learning to eat solid foods. We did that kind of mouth therapy. So I assumed that's what she was talking about. And the rationale for it was that he was not following even one-step commands with her. And she marked, there was a section for receptive and expressive language, and the choices were that it was fine, that it was mild, moderate, severe, or could not assess. And she had checked severe for that. And I was like, well, maybe expressive language, but certainly not receptive. He's always had very high receptive language. Yeah. And then I thought about it for a minute and I went, oh, yeah, he couldn't follow her one-step direction. Yep. That is a clear indicator that we are definitely on this Alzheimer's journey. So it was I had to stop and just pause for a while because, I don't know if you all remember, but as at the beginning of that journey, you kind of can go along and things look to be just normal. Matt's living his life, maybe not his best life, but he's still living a really good life. And then there'll be something like that that's the reminder of where we're headed. And it was really upsetting for me. I had to just get up and walk outside for a while and kind of just regroup because, it's kind of scary knowing that things are not going to get better.
Yeah. Listening to you tell this story, first of all, my heart goes out to your heart because these are the things we remember, very vividly when there's a big change. And it reminds me of some of the conversation we had when we were talking in our grief episode about, grief isn't always about when someone dies. Now you're grieving the loss of a skill, right? So, and we go through these stages as they decline. And now you're sitting here thinking about, okay, this is one more thing he can't do, and it's not going to get better with any kind of intervention or therapy. Because one thing we had to remind ourselves a lot was, sadly, this is a one-way street. And as much as you want to think that, well, if we do this and if we get therapy involved in PT, I'm not saying you can't at, earlier points in the journey, but that's where we kind of got to the point where we knew no interventions were going to change the outcome of this.
Right.
And that's heartbreaking.
It is.
It is. It's just heartbreaking. And so I'm sorry that you're going through this now and this is the next stage that you're at. But I also think there's a lot we can learn from it and, how we can work through it, help you together and how we can work through it so that maybe it's just a tiny bit easier for you or less, just less of a heartache because we're here for you and with you.
Thank you.
It's so true. I think you hit the nail on the head. It's, for me, what was so brutal wasn't so much, yes, there's the loss of skill, right? Like he's losing the ability to be really precise with his chewing and swallowing, but it's the reminder or the realization that this isn't fixable and we're no longer, we spend their entire lives rising to the occasion and teaching them how to overcome their struggles. And it is the reminder that this is a total abrupt mind shift to quality of life and modification on our ends, not theirs. Right.
Yeah.
That I think is so hard, and it's simultaneously liberating and difficult, right? Because it's brutal. It really is. You're walking down, like you said, Kristen, it's a one-way road and you're walking down it right now. But again, realizing it, knowing it, accepting it is really hard, but it makes the path a little bit easier. The act of accepting it is hard, but it's the acceptance that makes the journey a little bit smoother.
And I think that's, I'm still in that space where I'm not ready to just say, okay, this is what it is, and we're just going to, support Matt to be in his best life, because I have 51, almost 52 years of doing everything I can to increase his skills and make his life as productive as he can have it. And now we've had just a couple of years where we're going backwards, and it's one thing to intellectualize the point that you can just be in the moment and be with the person as they are, and it's something else to know it in your heart, and that's, I don't know if I'll ever get to that place. I don't know that I will ever get there. I follow a fellow on Facebook who is helping to care for his mother-in-law. And just in the short time I've been watching, I would say maybe about a year, I've been seeing his posts. And his mother-in-law is really going down. And the last post I saw a few days ago, she was extremely agitated, and they could like sundowning. And I think it was kind of getting towards supper time, late afternoon maybe, and they were trying to distract her and just support her, and she just kept getting more and more agitated. As I watched that, she can only say a couple of words now, and she uses that word for everything. And as I watched it, I tried to envision what that would be if that were Matt. And he's got paid staff who are there caring for him, not his family, who will put up with a lot of things. And it makes me curious about, is there a line in the sand where staff say, in the setting that Matt's in, because he's not in a nursing home, he's in his own home that he rents. And is there a line in the sand where the staff say, whoa, this is too much. I can't do this anymore. So it's hard to just say, I could say that, but I'm not the one who's with Matt 24/7, so I don't know.
And that's a valid fear.
It's fair. It's so fair.
And yeah, and I think, this is the catch-22 of all of this, right? Because as you said, logically, we know what's going on and we can understand. And if someone says, okay, now we're at this next stage and eating is becoming an issue, and we understand that when, as the brain is changing, right, everything in our body is, the muscles in the throat are changing, the ability to swallow, the ability to know the different steps. But emotionally, we're not there yet. We're not ready. And you said, I don't know if I ever will be. And I can speak from experience. I really don't think my mom really was ever there, even to the very last day, because you work so hard all of your life to get them on the far end of the continuum of independence. And I just remember so many times expressing that to people, it just feels so wrong, because now everything we've worked for in our lives to get our loved ones to be as independent as possible, now we're going completely backwards on the continuum. So you at times you feel like it's a failure on your part. Or if I give up hope, what does that mean? Am I failing them if I give up hope that So
Well,
it's
is
that,
it even giving up hope? But I would see that, like, adjusting how I support Matt is necessary. It's not that I don't have hope for him, but I don't know. That may not make sense. I don't
It does
know.
I
make
get what
sense,
you,
Jadene.
yeah, I get what you're saying. I mean, yeah, whatever words we're using, it's just a, ugh, it stinks.
Yes, it
Where we're
does.
at.
And
I mean, it stinks.
I think, honestly, I think in some ways the early stages are way harder than the late stages because of this very reason. Because you're in a very murky stage where maybe interventions can still help sometimes. And so I distinctly remember these early times with Aunt Kathy where we threw everything at the problem. Interventions and modifications on my end. I mean, we did it all. Like, let's see if something can help her. And also let's see if anything I do can help, modify her environment and my care as if she couldn't do anything, but also throw all the therapy and instruction at her in case something stuck to the wall. I do think in some ways these early stages, although they're wonderful because you still have so much of the person with you, can be really hard in that way because it's so ambiguous, it's so confusing, and there's no right answer, and you're just guessing all the time.
Right.
So let me ask a question about interventions, and I'm thinking about, we've had physical therapy because he's had gait issues with stumbles and falls, quite a few. So we brought physical therapy in, and he couldn't follow the directions, and which is surprising because I've done goofy dances with Matt in the past, and he mimics, but he wasn't even mimicking what the therapist was showing him. So my question is, if we bring in therapists and try to do some sort of interventional support, but they can't really follow the directions, are we not setting them up for anxiety because they can't do what we're asking them? I don't know.
It's definitely a concern. I think you need sympathetic and compassionate eyes on the situation. That's what I think. I erred, at least on the early stages, I erred on the side of let's try it. And I was there for all of the sessions. And I would actually, if she was having a bad day or a slow day, I would let the therapist know ahead of time. And I was really blunt. I told them, I don't want you to push her. Let's try. But we're not taking it to an extreme here. And, if all else fails, let's just do something fun. And, each therapy has its own goal, right? Physical therapy, occupational therapy, speech therapy. And so each one of the therapists had, I think, different plan Bs or ways to fall back if it wasn't going according to plan, right? So our physical therapist, my goal for bringing the physical therapist in was it's great if we can maintain her function, but worst case scenario, it just gets her to exercise, right? We're just moving her body. Occupational therapist, it's great if we can, again, maintain skills, but worst case scenario, the occupational therapist is there to show me what to do when things aren't going well. Speech therapy, it's great if we can get her to learn how to manage her food, but worst case scenario, the speech therapist is there to look and just observe and tell me about different cups and plates and things that we can use to help the situation. So I don't know if that answers your question, but
it does. And the pushing, when you said that, you gave instructions to those therapists. You don't want to push her, and I think that's where the anxiety would come in.
Sure,
is like if we feel like we're just, come on, Matt, move your leg this way, move your leg this way, until he gets agitated, then that's not serving him.
Right. So there was a rule a kind of a rule in my house, which was we don't want Kathy to feel like she's failing. So even if she's not doing it well, let's make her feel like she's successful. And we'll know. I mean, if she's not able to do it, like, oh, that's great. You did a wonderful job. Okay, we're done with that, right?
Yeah, that makes sense.
Yeah, I think in these earlier stages, it's just a trial and error, because we did similar things with physical therapy and occupational therapy earlier on in the journey. But when we did see that it caused any kind of anxiety or stress, and even because we would constantly ask our doctors, our team, but how do we know how much longer should we keep trying this? Or how do we know if this is not working? Or how do we know? And we had a very good doctor, and she said, he will let you know. He will let you know where he's at today. And you can see it in their facial expression, right? In any kind of behavioral thing that they might exhibit, or refusal to do something. And so if we ever got to any of those points, we just said, okay, this isn't working anymore. Let's just stop. But we feel good that we tried it. Then we didn't feel like we didn't give him a chance. And I mean, you're always going to look back and say, should we have done more of this? Is there anything more we could have done? I mean, that's just human nature. However, I do look back and say, you know what? We gave it our all. And the things that we knew didn't work, we just stopped, because we don't want to create any more anxiety and stress. This is a hard enough world to take in now, and how the processing changes, right? And so it's, and that's what's frustrating, because we don't know the answers and we don't know everything that's going to work. And neither do a lot of the people and the professionals that are working with our loved ones. We're figuring this out. No one's walked this journey together before.
So I have a question as we've been chatting. You know, we've named a variety of therapies. And I'm just thinking, you know, we have used speech. Matt had speech therapy years ago. We were trying to help him learn how to use a communication device, like on his little iPad or something. That's way gone. But speech therapy for now is about swallowing and eating and that sort of thing. Both of you have talked about a variety of therapies. And Kristen, I remember in a conversation we had once, you mentioned even music therapy when you were, I believe it was you, when you were with hospice. Molly, I think you did dog therapy or pet therapy.
We did music
or something.
therapy, and we did music therapy too, and dog therapy at the very end. But we did music therapy throughout.
So for our listeners and for my clarity, if we looked at physical therapy, why would we be doing physical therapy at this point in their lives? Did you both use physical therapy?
We did earlier on, yes.
We did earlier on too. And
was it for gait issues?
It was kind of for everything. You have to have a reason. I mean, there has to be a reason for it to be prescribed. So I forget what the reasons were, and there were different reasons at different times that we were able to have it prescribed. But my goal was just to keep her moving and to keep the muscles strong and to keep her as healthy and strong as possible during this transition, and also to keep the synapses, like the brain, connected to the muscles. I mean, the therapist did different exercises that resonated with Aunt Kathy. So things like stand at the kitchen counter and let's pretend like we're ballerinas and, you know, do leg kicks. She liked to count. And so she would love to count those kind of leg kicks. But it's that keeping that plasticity in their brain. I don't know if it worked. I don't know if it helped her stay at a plateau longer than she would have. But that was my ultimate goal, was to get people in to help me, to give her another face, another person to interact with, and to get professional eyes on what she was doing. And I took advantage of everything that was available to us. So whenever there was a problem with her, I'd call it in and say, can we get therapy for this?
Yeah.
And I think, well, so for us, I just want to start by saying, which we've all talked about before together, right? Human touch and human contact is so important, especially during this journey with our loved ones. So our therapies kind of changed and morphed into different therapies. Matthew had physical therapy in his situation. The big decline in his Alzheimer's was when he had a tonic-clonic seizure. And after that, prior to that, he was still ambulatory and walking around and doing things on his own, even though things had been changing. After the seizure, he never walked again. And so our initial thing with the physical therapy was, is he going to regain this ability to walk or stand or use his legs again? So that was why we started with that. Then once we figured that that wasn't going to be the case, he was not for 3.5 years. Then after that tonic-clonic seizure, he was, you could say bedbound, but we got him in and out and into a Broda wheelchair, and he did have the therapy for movement, and the therapist would come over and work his legs a lot and do different things in his arms. But then we transitioned it into massage therapy because that was more beneficial for him. So we went from physical therapy to massage therapy for the reasons that Molly said.
You're so lucky. I tried to get massage therapy and we couldn't find any visiting massage like medical massage therapists. That's wonderful, Kristen.
We were very lucky. We found this wonderful, amazing lady through a friend, and she really just had a soft spot for Matthew. I mean, she's a professional licensed massage therapist, but she prayed about it. She got back to me. She said, I feel called to do this. And I mean, and Matthew looked forward to her every time she would come in. He would smile. And yeah, so we were very lucky. But Jadene, I do want to go back to, because we started out this conversation with the swallowing and the
Right.
eating. And I think there's a lot of important things that we can touch on with this, because this was a huge thing for our family, and it caused all kinds of, we had a lot of cooks in the kitchen, so to speak, in Matthew's team, and we had different opinions on how we should approach it. But where you're at now with Matt looks like what is happening with what kinds of food is he eating? What kind of, is he mechanical diet? We can talk about what that is. Is he just getting things chopped up very small? What's going on with that, and what's happening, and what is his team doing about it?
The speech therapist has recommended a mechanical soft diet. He's able to still drink liquids without thickeners, but he's to use a straw, and he's reminded to sip slowly, and to eat slowly, because he has a tendency, if he likes what he's getting, he'll just shovel it in and just pack his mouth. And I don't know how many people with Down syndrome do this, but Matt used to do this whole chipmunk thing, where he would pack, and part of it was the tongue muscle wasn't strong enough to, I remember this from when he was little, the speech therapist telling us that, or maybe it was OT, telling us that his tongue did not have the muscle strength to sweep his mouth to help him clear and swallow, which is what can cause some of that chipmunking. But he still does that, and that can lead to choking. He's to be on soft foods, so he's not to get chips and crackers and anything that could be a little bit dry when he swallows. So those are supposed to be off the table now. And as I started our conversation today, that's what Brian was putting together, was the list of recommendations from the speech therapist on these are the kinds of things that he should eat. These are the kinds of things he should not eat. And then all the instructions for, one bite at a time, small bites, remind him to chew, remind him to swallow, remind him to take a sip between bites so that he's washing the food out of his mouth. I will say that we've not had a recent incident of choking, so that's encouraging. But I'm waiting for a shoe to drop. You know, I know too much and I'm waiting for a shoe to drop. But I'm grateful that we are where we are and he's doing okay.
Does he still feed himself? Is he still
Yes,
feeding himself?
he still
Okay.
feeds himself. Yeah, yeah, and that can be, and that's why, you know, staff is instructed. You must sit at the table, eyes on him the whole time. Don't be sitting there on your phone, and just kind of casually with him. You are to be a very attentive to Matt when he is having a meal, or
Right,
is
it's a
eating
vulnerable
anything.
time.
Yeah, so I have him up to my house to visit, and we try to do a supper time. And now it's a challenge because I think about the kinds of foods he likes and what I have been able to fix for him in the past. And I'm hoping to get him up this week, and the menu will be meatloaf and mashed potatoes and some sort of a green vegetable that will get smushed, maybe green beans, that will get smushed till where they're, you know,
Yeah.
pretty soft, you know.
Mushy.
Yeah, pretty mushy. So maybe 2 seconds in the blender or the food processor even. So that's kind of where he is now. He still loves to go to McDonald's and have, or Dunkin' Donuts or wherever, Burger King. No endorsements of any kind. he still likes to go to fast food and get a hamburger or chicken nuggets, and that can be challenging because eating out has become a challenge for him because staff have to take him to places where they can get the food to the consistency. It's not so easy to go for pizza, you know, because of the crust and that kind of thing. So, and to do that out. Now, pizza in the house is different because we can prepare it for him in a way that is not a hazard to him. But
I think it definitely it is more work. But what I've learned is that it's actually pretty doable as long as you have a plan. So I've heard of people buying those little portable blenders that they take to restaurants and making sure that they've got a packet of gravy or a packet of chicken broth or whatever. Because it's surprising. What I learned is that it's very surprising how often you can make foods that you never thought you could into something that's mechanical soft, or what we called was a minced and moist diet. For us, our two staples for doing that were maple syrup for all the sweet stuff and gravy or broth for all the savory stuff, right? Like you can blend up some pizza with some chicken broth and at least it tastes like pizza. Might not feel like pizza, but it tastes like pizza, right? But I thought the idea of buying one of those little portable blenders was a really good one that I've heard from people.
so I'm guessing when you say that they're battery operated.
I believe so, yeah.
Oh, I'm going to have to look that out.
Yeah, and
yeah.
I think there's like a NutriBullet and I don't know, like some other little, some little ones that you can just put in your purse. And it's like a little single serving one. But
Right.
yeah, it's like you got to bring a little kitchen utensil bag with you, right? Like a little spatula and a little blender, but it's doable, I think, to a point.
Good tip.
And I think one of the challenges that we faced as a family, because the eating, my mother is 100% Italian. And how do you show people you love people when you're Italian? You feed them, right? You feed them and you give them food. And so that was her love language with Matthew. And when these changes started happening with his eating, the struggle was believing that we're hastening the decline by having to change the way we feed him. Mechanical soft, even going, oh my gosh, now we're going to puree. We're going to be making the disease progress faster. However, the good news is that we learned from our doctor and the occupational or speech therapist, I can't remember, was no, we're not hastening anything. We're actually making it safer for them to eat. So by preparing the food the right way, now he can eat more safely without the risk of choking, because even a choking incident can take them down to the next level in decline, right? Anything, any incident or event can take them down that next step, before they might plateau out for a while. So for me, that was really key to hear that. Like, I just kept thinking in my mind, and I'd have to remind my mom, we're not making anything go faster. We're just making it safer for him to eat. Even so much so, as Jadene, you said, Burger King and McDonald's. Well, Matthew's favorite was Arby's. And when he was on strictly pureed diet, it was so gross, but we would blend up an Arby's roast beef sandwich in the blender and he would eat it because it was a safe way for him to still enjoy the things that he loved. And Molly, the broth, we were using the broth a lot, anything that we could mix to make things softer, the liquids, the thickener. I think it's called thicket or there's different things out there to make drinking safe, because the brain is trying to figure out how to do all different kinds of things. And one thing that I want to say just before I forget, the worst thing you can give someone that's further along in the eating decline is soup. And our doctor made the analogy of think about all the things that we don't even think about. When we're eating soup, your brain has to think about, I put the liquid, I have to swallow the liquid, and then I have to move maybe the particles over to one side of my mouth. You're doing different things. You're swallowing liquid, you're trying to chew solid food. And so soup was like a no-go for us after a certain point, because it's too many things for your brain to process and think about at once to get one mouthful of soup down. And then that would cause more choking, because they're trying to swallow the broth and they don't know what to do with all the other things in their mouth. So I want to put that out there, because I had never even thought of that. Didn't even cross my mind that, that could be an issue.
But I guess you could blend it up, right?
Yeah. I mean, if you made it thick, as long as it was at that point, if you're at that point,
But also the speech therapist told us that it depends on the person, because some people actually need things thinner. So when she was observing Kathy, I was like, is it time for thicket? And she was like, you can't just go there, because not everyone progresses to needing thick. Some people progress to needing thinner. It depends on what's happening with whatever the flap is in your esophagus.
Okay. Yeah. No, I didn't know that. Yeah.
Yeah. So we had bought thicket, but she told us, don't use it. Don't just automatically think you need to use it. And I think that it's not something that they can observe. I think that determination can only be decided with an actual imaging test to see. It's something about the flap.
The flap, yeah.
Like the mechanical,
like which direction.
Yeah,
where's the deterioration, right? There are two different ways. And I didn't know that either until she told us that. And it was... that because I thought everyone needed, at some point would need everything thicker. But it's so funny that you were talking about Arby's, because one of the things that Kathy used to like was, she liked all that stuff, but where we settled was the easiest thing for her to eat was Philly cheesesteak from Penn Station. And it was so gooey, and it was already chopped up anyway. I would soak the bun in broth and get it to be really kind of gooey. And then I would chop it all up. And so it still had some texture. I didn't puree it really, but I would chop it all up. And it was it turned into this kind of stew that was really easy for her to just kind of take little bits and let it all kind of dissolve in her mouth. And she loved that.
That's
it all tastes the
same. And you're right, it looked disgusting.
It does look gross, yeah. No, the only thing I want to add to that is just because people that are listening might be at different places and stages with this and the eating. And the other piece of advice that always stuck with me from our doctor was, if you're at the point where you're having to feed your loved one, our doctor would always say, if you think you're going slow it down even more. Sometimes it would take an hour to get through a meal, or depending on if it was a snack or something. And that was just a great piece of advice that we always kept in our minds. When you think you're going slow, take it slower. And again, for the safety.
Yes, that was years and years ago when we first moved back to Clearwater. I worked as a program coordinator in an intermediate care facility. And one of the things that, as staff, the occupational therapists that worked with our residents had us do was feed each other. So you got to experience what it was like having somebody come at you with a spoon or a fork with food, and how to put that spoon in the mouth. It was some of the best training I ever had for that type of thing. It was very eye-opening that, you don't overfill the bowl of the spoon, and
even the amount, how much you put in the spoon is important.
It's surprising how little it takes to be too much in your mouth, so I would be, a recommendation I have is, if you're working with someone or your family is there, feed each other and get a sense of what your loved one is experiencing when you're the one bringing the spoon to them. So
I never even thought about doing that. It's so funny because I used to try everything that Kathy had to do. I would try on the pull-ups to see which ones were the most comfortable. I would sleep on one of the bed pads to see which ones made me hot. I would, if I could have taken her medicine before she ever started one, I would have. But I never thought about having somebody feed me.
Yeah, that's a great idea. And you mentioned earlier that, like, the chipmunk, which they call pocketing, right? So that's another stage in the. Also, I mean, I know a lot of our loved ones, they have a tendency to eat fast and do that with the food, but it's also a very common symptom of Alzheimer's is the pocketing, when they start pocketing food, and that's something to really be aware of. And also, if they have a tendency to pocket food, or if you're not cleaning their mouths, really well afterwards, anytime if Matthew would show any kind of discomfort, or if he had a little bit of a fever or anything, the first thing they would check is his gums. Or does he have any kind of infection in his mouth? Because if food's sticking around there, or you're not doing, cleaning very well, or teeth brushing, then that's just something to keep in mind too. Like, make sure their mouth is always clean and healthy. So you're not running into any of those issues with infection and stuff like that.
And Matt is without teeth, but he still needs his mouth cleaned on a regular basis. It's even though there are no teeth there, the mouth itself needs cleaning. So, we have instructed the staff that there may not be teeth to brush, but his gums need that stimulation, and we need to make sure that he's not. And I can only imagine that if he has pocketed food and then he's gone to bed, that's a risk for choking.
A risk,
yeah.
Sure.
So just going back really quickly to feeding themselves, one thing that I found helpful with Aunt Kathy was long before her actual mechanical eating became a problem, she had more difficulty with the hand-eye coordination of feeding herself. So we actually bought these reusable pouches. I don't know if you've seen any of those baby food pouches, but they have silicone ones that are washable and reusable. And that was a big help to us for a while. I would make oatmeal and make sure that there was lots of maple syrup in it, so it wasn't so goopy, and put that in there, and she could kind of just, I don't want to say drink it, but eat it through the pouch. And it was also sensory too, because it was squishy and she could kind of chew on it or gum it, And then when I realized how much she liked doing that, I started buying these protein pouches that they use, that you can use as an athlete or whatever for post-workout recovery, that had no sugar, and they were just full of good stuff. It was mostly whole food, but anyway, she really liked those too, and they weren't really thin. They were almost like pudding or yogurt consistency, and I think they have yogurt pouches too. So start shopping in the athlete or in the baby aisle too.
And going before they get to that point, Matt talking about, the whole eye-hand coordination and being able to maneuver the spoon and keep the food on it, or use the fork and scoop with a fork or stab with a fork. Those are a lot of skills that, I bought Matt several years ago, and he was having difficulty with the regular plate. And so I found a plate that I guess occupational therapist would have used, but it's got raised sides and there's a little bit of a slant to it. And then I have special utensils. At Christmas, I gave him utensils that have rubber around the handle, so it's a bigger to grasp, and that seems to be helping for now. His cups, I don't know that they use them because primarily they use his travel mugs that have the straw, but it has cups that have like sippy cup lids, but it's got a broader base, so they're not as easy to tip over. So those have been helpful.
Yeah, those are good ideas. And you can find a lot of that on Amazon, just so,
Yeah.
if people are wondering
That's
where
where
you
I
get
got
these.
them.
If you just type in, therapy cups or plate.
Adaptive
whatever.
dinnerware.
Yeah, yes, yeah. So, but those are all great ideas that people, and straws were a big thing. I mean, that was very helpful in the drinking when we had to transition from just drinking out of a regular cup to using straw. And the thick straws too worked for us.
Right.
Yeah. And Jadene, if drinking too quickly is Matt's problem, did you say that was a problem?
Sometimes, but
Like
he
getting
uses
too much
a
liquid
straw.
at the same time?
He uses
There
a
are-
straw, so it's not as big a deal as the food
Gotcha.
is. But yeah.
There are special cups that look like sippy cups, and they have something at the bottom that interferes with the sucking so that it actually regulates how much they have to work harder to get it up. Just know that exists too.
Oh, that's a good point. At this point in his life, that would make him mad, and he would probably throw the cup back at you.
Get frustrated at it. Yeah.
Yeah.
I didn't use it either because also here's the cruelty of it. They need, or at least we needed to increase her, like we were always trying to increase her liquids, right? And it was like,
Liquids, yep.
oh, for crying out loud, come on. Like I need to get more liquid in her, not less.
Right. That is something that we have noticed. Matt has always gone through several travel mugs full of liquid, whether it was iced coffee in the morning or water or flavored water. He always drank a lot. And in the last year or so, it's a struggle to get him to go through even one of those. And, that's staff saying, Matt, take a drink, Matt, throughout the day. And he'll take a little tiny sip. So dehydration is a big issue for us with him. But
Yeah.
I don't know how we deal with that other than maybe take him in for liquid IVs once in a while. I don't know. I know. That's been a concern and a challenge for his staff, is that he's cut way back on his desire to have liquids. So this is an interesting journey that we have all been taking part in, and I don't know. I'm grateful that I've got it, and even more grateful that I have you two to hold my hand as I support Matt through it.
Yeah, I'm sorry that this you got a rude awakening this week, but we appreciate you being able to share it, being willing to share it.
Yeah. Thank you for being open and vulnerable with us. And you know what? Here's the thing. If you're going through it, Jadene, somebody else is too. So I hope that just listening to these conversations and maybe some ideas, things that we've said can help you and can help somebody else. And we're with you through this journey. And
Thank you.
like we've said, nobody should have to do it alone. So
Right. Absolutely.
we're in this together.
Absolutely. Even if we are isolated from support physically, the fact that we have this amazing technology to bring us together is such a blessing as we're on this journey, because I truly believe that people who have dealt with dementias in their loved ones, in the general population, really don't understand the difficulties that we face as parents, siblings, and extended family members as we watch our loved ones declining, because it is different. There are some similarities, but there's enough differences that it's important that we find people who are on this path with us. So.
Well, nobody prepares you or at least nobody did prepare you as a parent that you would ever have to deal with a child going through dementia.
Right.
That was just never imagined, right?
Right. I have been asked to give a statement to the Food and Drug Administration, and that's one of the things that I mentioned was that, I feared for myself for getting Alzheimer's because there were studies done early 90s, I think, that showed if you had a baby with Down syndrome in your 20s, you were at an increased risk for Alzheimer's. So when he got the diagnosis, it was like, whoa, where'd that come from?
We're like, what?
Yeah. I remember laughing when Matt's behavior analyst first brought this up and said, this was before he got the diagnosis, that perhaps this is what was going on. He was having some other issues. And I was like, what? No, it didn't make any sense. But boy, have I learned a lot in the last 10 or 12 years. Yeah, it's craziness.
Well, we love you, Jadene, and we're going to stick with you and by your side through all of this.
Well, I appreciate it. And so does Matt.
Oh.
So does Matt. Yeah. Kristen knows she got to get hugs from him.
Oh,
I got to hug and sing with him, and now every time I hear his favorite song, Stevie Wonder, I just call to say I love you. I think of Matt.
Yeah.